Hi everyone and welcome back to my channel. If you are new, then hello for the first time. Make sure you hit the subscribe button and turn on your notifications. Today I'm going to tell you all the medications that you will be prescribed after a Septoplasty Bilateral Submucus Resection Inferior Turbinates surgery. I'm not the one that personally had the surgery, but my very close friend did, and I helped him with his recovery process. So I'm just going to go over how often you give each medication, what each medication is for, a few side effects to look out for. First medication we have is right here, Mupirocin 2% ointment. Comes in a box like this. Once you open it up, and then you apply it post-operatively into the internal nasal incision 3 times a day using a Q-tip, and you do that for 2 weeks. Used to treat skin infections that is specifically caused by the bacteria Staphylococcus aureus or Streptococcus pyogenesis. Some of the side effects or adverse effects you want to be on the lookout for, and definitely contact your healthcare provider if you experience any of this. One of them is an allergic reaction. Consists of you feel your heart pounding, heart rate, which is also known as tachycardia. You have difficulty breathing, wheezing, if you have a rash over any parts of your body, if you experience any swelling on your mouth, face, or tongue, or if you have any hives anywhere. The next medication we have is ondansetron, and it comes in little tablets looking like this. This medication is used to treat nausea. After surgery, post-operatively, you're going to want to dissolve 1 tablet on the tongue every 4 hours as needed for nausea. Make sure you open the package with dry hands and just dissolve it right on the tongue or in your mouth. This drug may cause dizziness, so you don't want to operate any kind of machinery or drive a car, or if you do, you want to make sure you use caution. You may have a headache with it. It may cause some drowsiness. Now we have Zithromyosin. You may know of it being called Cythromax. You will take this 2 tablets of this by mouth 5 days right after surgery. This is an antibiotic, and it works by stopping the growth of bacteria. It can either be taken with food or without food. It's up to your preference and how you react to the medication. You do not want to take any aluminum or magnesium antacids within 2 hours of taking this drug, because you will experience very adverse reactions if you do so. This drug may cause you to have diarrhea. So if you keep having diarrhea, you want to make sure you notify your healthcare provider. To have diarrhea that will occur like weeks or months after taking the drug. If that does happen, then you want to make sure you do notify your provider of that. Next medication is Hydrocodone Acetaminophen. Since it has acetaminophen in this, you're going to want to make sure you don't take any more than 4,000 milligram daily dose of acetaminophen. If you take more than that, it will cause you to have liver problems, since it does have a risk of opioid overdose. Since this is an opioid medication, you will want to keep track of how much you take and how often you take it so you don't experience those complications. Naloxone is an antidote for that medication. The side effects you want to be on the lookout for is drowsiness and dizziness. Make sure that you're not operating machinery or you're using caution when driving. This medication is given 1 to 2 pills every 4 to 6 hours as needed for your pain. This is not a medication, but this is the other thing that we used for after the surgery. It's these cushion gauze pads. These are very large, so what I just did is I cut a bunch of them up into little squares so we can fold them over and put them on his nose with that strap around it to help catch the bleeding. I have this Afrin nasal decongestant spray. It comes in a box like this, and it looks like this. To use it, you open it up and then you pump 2 to 3 pumps in each nostril every 10 to 12 hours. It shrinks the swelling inside your nose to help relieve that nasal decongestion. You do not want to use it more than 3 days. If you use it more than 3 days, it will cause your nasal decongestion to worsen. You can experience some discomfort using this. You may feel some stinging or a little bit of burn. Nasal discharge may increase while using this. You do not want to share this with anyone. Only use it for yourself. If you do share it, it can spread infection, and we do not want that to happen, now do we? The last thing that we have to use for this surgery is this Neomed sinus rinse. This is a saline wash. Do this twice a day for 2 weeks after surgery. The kit that I got with this corticosteroid spray, but the surgeon said that we don't need to use that. Ignore that part. It comes inside a bottle, all kinds of bunch of little packets. For this, you will want to order distilled water. You have to use distilled water to mix with this in order to properly cleanse out and irrigate your nose. I have attached a link to using the Neomed nasal rinse and how to properly use it, mix it in there and with what exactly the amount and how to do it. So you can click the link above or the link below. If you are watching this video or you're about to have a Septoplasty Bilateral Submucus Resection Inferior Turbinate surgery, I would love to know if you were prescribed the same medication regimen, or if not, what other medications were you prescribed, because I'd be really interested in to hear that. So please comment down below and let's get to know each other. And thank you so much for watching this video, and I hope you enjoyed it. If you did enjoy it, please give it a thumbs up and make sure you subscribe.